I was asked to spend 10 minutes to talk about what's happening in the U.S. on anti-criminalization advocacy, which is a bit challenging. I think primarily I'm focusing on the work of the Positive Justice Project because it really is, as far as I know, the only national organized attempt to bring in people from a variety of disciplines to address the issue of criminalization in the U.S. It was launched a little over a year ago. We have 7 different working groups focusing on all of those areas, from federal advocacy and state advocacy to specifically public health and legal issues and research. And we have quite a few members. I'm just going to summarize some of the things that this group has been working on, because we do, through the members of the Positive Justice Project, probably have our fingers in most of what's happening around the country on this. Some of our work led to the National Association of State and Territorial AIDS Directors issuing an excellent, I think, statement on opposing criminalization or raising the issues of the public health merits of not revisiting that issue. The President's Advisory Council on HIV and AIDS had agreed, after some advocacy, to identify it as a priority recently to the administration. We're working with the Department of Justice and the CDC. Some of that I can talk about if anybody's interested. Some of that is kind of in the works. And Congresswoman Barbara Lee released in September a bill to address criminalization through both directing federal agencies to do a very broad-based review of a variety of different constituencies to make recommendations and best practices, and then to monitor how that happens in the states, and also provide some funding incentives to get states to follow through. So a lot has actually happened over the last year at that level, and it really, in my experience, doesn't happen unless you are involve a broad range of organizations and allow lots of people to get involved and visibly involved beyond your own organization. We also are doing a lot at the state level. We target places where there's a lot of activity and are starting kind of at the community level, because what we found, and what I think many of the people in this room know, is that there is what initially feels like almost invincible ignorance at every level, from the bottom to the top, about not only what HIV criminalization laws are and their impact, but on the actual routes and risks of transmission. And what the impact of actually living with HIV is. There has been activity in a number of states, which I didn't include here. Most of it not good, and some of it, which is okay, is worrisome, because again, if policymakers aren't educated, if there isn't a starting basis of understanding, the likelihood that you're going to get a good outcome, I think, is questionable. So we're doing a lot of public education. I wanted to just identify some of the arguments that we're using and that seem to get, when I mean traction, people actually wake up and listen, and it seems to move people along. And some of this is reflected in the draft bill that came out of Congresswoman Barbara Lee's office. It really does reflect the points that they felt had traction, and there were a variety of things that we threw against the wall, and that bill actually represents a lot of what's stuck and they think will stick. It's posted on our website. If anybody's interested, we can talk about it later, but some of the things that are clear is that we have to address that the laws are based on extraordinary ignorance about the risk of transmission and how you can get infected. Many bills, as you know, and laws assume that spitting and biting is a route of transmission. and that any sexual contact, regardless of the type, whether we're talking about oral sex or receptive anal sex, poses the equivalent risk and needs to be criminalized. And I think the next point is one that I want to highlight, because this is the point that really gets state and federal policymakers to listen when you argue that there are policies that are directly undermining the money that they are spending to encourage people to get tested and to disclose their HIV status, because the consequences of doing those things are the primary basis, are the primary requirements for being prosecuted. So that's some, and as folks like Carol and other people in this room know, we don't have much information. There are a lot of assertions that it has an impact on people's willingness to test. Anecdotally, when people know what might happen, that appears that it may be true, but we can't actually say that because we don't know that it's true. The lack of proportionality, a lot of folks will think, yes, anybody who has HIV has the primary, ultimate, sole responsibility to disclose and protect people from infection. What many people don't know is what happens if that person is actually prosecuted. The fact that it can result in decades-long sentences, it also appears, again, anecdotally, another area we need research, that some of the isms that have been outlawed through other measures, prohibiting discrimination on the basis of race and disability, get acted out on through the acceptability of criminalization laws. These are just some of the information things that are pulled out from some of the stuff we give to both community people, policymakers. It's all adapted based on who it is we're speaking to, but getting folks to understand what the actual risks are of transmission in a single sexual contact, and understanding that if we all limited our sex lives to blowjobs, there wouldn't be an HIV epidemic, and we should stop pretending that that's not true. And then this is the kind of thing that illustrates the disparity in sentences, that it is actually, if you want to kill somebody, you have a far more narrow window of penile, meaning the penal system, excuse me, vulnerability. If you run somebody over with a car, than if you have sex with them while HIV positive. And these are just a couple of the states that illustrate that point, but there are many more. And I think when people actually see that, okay, I could get in a car, run him over and kill him, and I'll get 6 months, whereas if I have sex with him and give him a blowjob, I could spend 15 years in prison. They begin to see, okay, there's something going on here that is not entirely rational.